Have you ever taken a vitamin thinking it would help you, only to learn later it might actually harm your health? It's surprising, but some vitamins, when taken in the wrong way, can do more damage than good. And in today's video from Rise Your Health, we're uncovering the shocking truth about one specific vitamin. A vitamin so many people take daily, believing it protects their heart and brain. Yet research shows that in the wrong amounts, it could raise your risk of stroke overnight. Stay tuned until the very end, because I'll also reveal a bonus nutrient that most doctors don't talk about, but it can actually protect your brain and lower your stroke risk. Let's get started. Why this matters after 40. Once you cross 40, your body starts changing. Blood vessels become stiffer, circulation slows down, and your risk of high blood pressure, diabetes, and stroke naturally increases. That's why many people turn to supplements. We're told vitamins will fill the gaps, give us energy, and protect our health. And yes, some vitamins are essential. But the truth is, more is not always better. When you overload your system with a nutrient you don't need, it can push your body out of balance. For the brain and blood vessels, this imbalance can be dangerous. The vitamin in question, vitamin E. The vitamin we're talking about today is vitamin E. Vitamin E is a fat-soluble vitamin, meaning your body stores it in fat and the liver. It acts as a powerful antioxidant, protecting cells from damage. You'll find it in nuts, seeds, vegetable oils, and green leafy vegetables. Sounds good, right? So how can something so healthy be harmful? The answer lies in supplements. Vitamin E and stroke risk. For years, supplement companies promoted vitamin E as a miracle vitamin for the heart and brain. The logic seemed simple: antioxidants prevent damage, so they must prevent disease. But studies tell a different story. A large meta-analysis published in the British Medical Journal found that high doses of vitamin E supplements increased the risk of hemorrhagic stroke, that is, bleeding in the brain. To put it simply, too much vitamin E thins your blood. And when your blood is too thin, you're more likely to bleed, even inside your brain. That's why experts now warn that high-dose vitamin E supplements, especially anything above 400 IU per day, may be unsafe, particularly for older adults. Why does this happen? Vitamin E has an effect similar to blood thinners. It interferes with platelet aggregation, the process that allows your blood to clot. Now, in small amounts, that's not a big deal. In fact, for someone with thick blood or high clotting risk, a little thinning can help. But when you push too far, your body loses its natural balance. Imagine cutting your finger and bleeding longer than normal. Now picture that happening inside your brain, where there's no space to handle bleeding. That's what a hemorrhagic stroke is, and it can be deadly. The silent risk after 40. Here's why this matters most for people over 40. Many already take aspirin or blood pressure medicine, which also thin the blood. Adding vitamin E supplements on top of that can double the risk. Seniors often have fragile blood vessels due to years of wear and tear. Even small bleeds can become serious. Because vitamin E is fat-soluble, it builds up in your body. You may not notice problems right away, but over time the risk grows. How much vitamin E do you really need? Here's the truth: most people are not deficient in vitamin E. If you eat a balanced diet, you probably get enough already. The recommended daily intake for adults is just 15 mg per day, that's about 22 IU. Compare that to the 400 IU found in many supplement capsules, and you can see the problem. That's nearly 20 times more than what your body actually needs. Natural food sources are safe. The good news is, vitamin E from food is safe and beneficial. Whole foods contain vitamin E in natural amounts that your body knows how to handle. Great sources include almonds, sunflower seeds, spinach, avocados, olive oil. Eating these foods supports your health without the overdose risk. Nature balances nutrients in ways supplements often don't. What studies say? Let's quickly look at what science has shown. The Heart Outcomes Prevention Evaluation, HOPE, trial tested vitamin E supplements in thousands of people. The results? No benefit for preventing heart disease, but a higher risk of bleeding strokes. A Finnish study of smokers taking vitamin E found increased stroke risk in those using supplements, especially hemorrhagic strokes. The National Institutes of Health now warns against high-dose vitamin E supplements unless prescribed by a doctor for a specific condition. The evidence is clear: high doses of vitamin E are not a free pass to better health. They can backfire. Who should be most careful? If you're over 40, and especially if you have any of these conditions, you need to be extra cautious with vitamin E supplements. High blood pressure, history of stroke or mini-strokes, use of blood thinners like aspirin or warfarin, diabetes, smoking history. In these cases, talk to your doctor before touching any vitamin E capsule. Better ways to protect your brain. So if vitamin E supplements aren't the magic pill, what should you do instead? Focus on the proven lifestyle factors that reduce stroke risk: balanced diet, eat fruits, vegetables, whole grains, and lean protein. Exercise, even 30 minutes of walking daily improves blood flow and lowers blood pressure. Hydration, dehydration makes blood thicker, increasing stroke risk. Sleep, poor sleep damages vessels and raises blood pressure. Stress control, chronic stress raises inflammation and harms brain health. These simple steps are far more powerful than relying on a pill. Bonus nutrient, omega-3 fatty acids. Now, here's the reward for staying until the end. There is a nutrient that truly supports brain health and lowers stroke risk, and that's omega-3 fatty acids. Found in salmon, sardines, flax seeds, and walnuts, omega-3s reduce inflammation, improve circulation, and help your brain cells communicate better. Multiple studies show that people with higher omega-3 intake have lower risk of stroke, dementia, and heart disease. Unlike vitamin E supplements, omega-3s from whole foods are both safe and effective. Aim for 2 servings of fatty fish per week or add plant-based sources daily. Recap. So, let's summarize what we've learned. Vitamin E is an important antioxidant, but too much from supplements can raise your stroke risk overnight. The danger comes from high doses, usually above 400 IU per day. Natural food sources are safe and beneficial. If you're over 40, especially on medication, be very cautious with supplements. A better choice for brain protection? Focus on healthy habits and add omega-3s to your diet. So now I'll ask you, have you ever taken vitamin E supplements? Did you know about this hidden risk? Let us know in the comments. I reply to every single one. If you found this video helpful, please like it and subscribe to Rise Your Health. Daily, we bring you practical, science-backed tips to help you age with strength, energy, and confidence. Remember, your health is not about chasing miracle pills. It's about small, smart choices that build up over time. Take care of your body and your brain. They're the only ones you'll ever have. Stay healthy, stay strong, and I'll see you in the next video.